A new health alert is out regarding this year's influenza season. Scientists are predicting this to be one of the most severe influenza epidemics in recent history. Our medical expert, Dr. David Winter with Baylor Scott and White, joins us live from his office. Dr. Winter, great to see you.
Hey, good to be with you, Tiffany.
Now tell us why this new alert, and where did this prediction come from?
Yeah, we usually get lucky because influenza epidemics usually start in Australia and the southern hemisphere. And this year, they say they had the worst epidemic in Australia ever. They call it the super flu. We're also seeing big epidemics in Japan. Israel's reporting that. It's building up right now in England, and they say already they're having 3 times as many cases that they had last year. Not many cases here yet, but it's starting to happen. And it looks like it's going to be a severe one this year, Tiffany.
So what's going on here? Why is influenza thought to be more severe this year?
Well, the influenza virus mutates every year. Most mutations, or many of them anyway, are mild. This one looks like it's a bad one. It's H3N2 with subtype K, and that's the one that's real nasty in 2 ways. One, it's more contagious, tends to jump around more, and also it causes more severe disease. So we need to get ready for it, Tiff.
Dr. Winter, we always ask this question, but is the flu vaccine going to work on this new mutation?
It does work. Now, it may not keep you from getting the flu, but it'll certainly make you from getting a severe case. You won't have to be hospitalized. So I do recommend it. Now, the problem this year, though, is many people aren't getting the vaccine at all. And so that allows the flu virus to jump and be more virulent this year. So I worry about that. But yeah, the flu vaccine does seem to help.
Can you tell us, how do we know if we're coming down with the flu? Any tip-off in the symptoms that come first?
Yeah, the symptoms usually come on abruptly. You get a severe headache, big muscle aches, a lot of fatigue, spiking fever, a dry, hacking cough. That's kind of the hallmark. Now, some of the other diseases, COVID, RSV, the common cold, even some mountain allergies, those can also be similar. So I tell folks when they call me and say, I think I've got the flu, I say, come in, let's get a test, or go to the pharmacy and get one of those test kits. We have to be sure, because what works for influenza doesn't work for COVID, vice versa. So you got to have the right diagnosis.
Right. What is your overall advice for us to stay healthy this winter season?
Well, beware. It looks like it's going to be a bad season, so be careful in large crowds. If you see somebody coughing or sneezing, hold your breath and try to get away from them. Most of the influenza virus is spread through the air, but you can get it from touch. If somebody who's got influenza touches a tabletop or a doorknob and then you touch that and wipe your face, you got it. So beware out there. If you haven't had a flu shot, you might consider it. It takes about 2 weeks for it to work. Get it as soon as possible, because this is going to be a tough year. I'm worried about it.
Yeah, great tips today. Thank you so much, Dr. Winter. We always love having you on our show.
Thank you, Tiffany. Good to be with you.